we will take the Norma Basalis. That is the inferior surface of the skull. So when we see the skull, because skull is bilateral symmetrical, so what is on the right side, same is on the left side. So it is better to take half of it, same. So anteriorly there is a frontal bone is seen here with the orbit, and medially there is a inferior border of the maxilla, which is also called the alveolar border of the maxilla. And these are the alveoli for the tooth of the maxillary part. Medially there is a hard palate, an incisive canal is there anteriorly for the passage of the greater palatine vessels. Just posterior to the hard palate there lies the two pterygoid plates, medial pterygoid plate with the pterygoid humulus on its lower border, the lateral pterygoid plate, and in between the two there is the pterygoid fossa. So this is the part of the sphenoid bone. Laterally there is the zygomatic arc formed by the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. And posteriorly, this is the root of the zygomatic process. So anteriorly, this is the part of the temporal bone. And here lies the inferior orbital fissure. This is the part of the temporal bone. Just medial to the root of the zygomatic bone, there is a raised area. This is the articular tubercle. Behind this, there is a fossa. This is the mandibular fossa for the temporomandibular joint. So laterally, the articular tubercle and the zygomatic arc, this bone is the greater wing of the sphenoid bone. And the medial and lateral pterygoid plates are also the part of the greater wing of the sphenoid bone. In this area, just posterior and lateral to the lateral pterygoid plate lies here the oval foramen, that is the foramen ovale, and posterior lateral to it there is small foramen, that is the foramen spinosum. Ovale is because of its shape is oval, and spinosum is called spinosum because only the tip of the spine can enter, so it is so small. Only tip of the small spine can enter into it. The foramen ovale contains four structures. mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. While the foramen spinosum, it contains middle meningeal artery, middle meningeal nerve, and emissary vein. So they are in the greater wing of the sphenoid bone. Just lateral to them, here lies the Norma Basalis. The petrous part of the temporal bone and the greater wing of the sphenoid, there is a gap, and it is an irregular gap, and this irregular gap is called foramen lacerum, and through the foramen lacerum passes the internal carotid artery with sympathetic plexus around it. Just lateral to it, there is a almost round foramen. This is called the carotid canal. If I put a wire into the carotid canal, it will come out through the foramen lacerum. It means carotid canal and foramen lacerum, they are interconnected. In the carotid canal passes the internal carotid artery and internal carotid nerve. Internal carotid nerve is nothing but this is the continuation of the upper part of the cervical sympathetic chain. So above the superior cervical ganglion, the sympathetic chain is called the internal carotid nerve because it accompanies the internal carotid artery and enters through the foramen into the carotid canal, and both of them they go into the foramen lacerum, where the artery forms a sinuous course, and the sympathetic internal carotid nerve immediately divides into a bunch of small fibers around the internal carotid artery, and wherever the branch of the internal carotid artery are going, the sympathetic fibers they go along with the artery, the branches. So this is present in the petrous part of the temporal bone. Then just medial to the carotid canal, there is a sharp bony projection. This is called the styloid process. This is the styloid process. The styloid process is also the part of the temporal bone, and various structures they are attached to this one. Just anterior to the styloid process, to the temporal bone and the meeting of the greater wing of the sphenoid bone, the posterior part of the sphenoid bone here, just anterior to the styloid process, there is a very sharp spine. We call the spine of the sphenoid. The spine of the sphenoid, it gives the attachment to the sphenomandibular ligament, which is to the mandible. It is attached to the tip of the lingula near the mandibular foramen of the mandible, the ramus of the mandible, and this sphenomandibular ligament is pierced by nerve to the mylohyoid and the inferior alveolar vessels. Then just lateral to the styloid process, there lies the shape is like the nipple of the breast, and that is because of the shape. It is called the mastoid process. It resembles the nipple of the breast, so it is called mastoid process. It is a pneumatic bone containing small, medium and large cell of the air cells in it. And in between the mastoid process and sternal process, here lies the stylomastoid foramen. And this stylomastoid foramen, the facial nerve becomes extracranial from this part. Then anteriorly, there lies in the midline of the hard palate, at both the sides, there forms the posterior nares, and because of this posterior nares, in the center there lies the nasal septum. The posterior part of the nasal septum. So the hard palate lies anteriorly, and just below the middle of the hard palate there lies the nasal septum, and here lies the posterior free border of the vomer bone which forms the nasal septum is seen here. So this is the vomer bone of the nasal septum, and when we trace it upward, it is attached to the undersurface of the hard palate. And between the vomer and the hard palate, laterally here lies the vomerovaginal canal. Vomerovaginal canal. Then inferiorly and posteriorly here, behind this greater wing of the sphenoid bone, which is forming the in the midline, this is the greater wing of the sphenoid, and immediately here comes the body of the sphenoid bone. And this body of the sphenoid bone here meets with the occipital bone. So this bone is the squamous part of the occipital bone, and in the midline it meets with the anteriorly with the body of the sphenoid to form what is called the basi-occiput or the clivius in the middle cranial and posterior cranial fossa. So this is the inferior surface of the occipital bone, posteriorly and anteriorly the inferior surface of the body of the sphenoid bone. So posteriorly the foramen magnum is formed by the occipital bone around the squamous part of the occipital bone. So just anterior to the foramen magnum, here lies the pharyngeal tubercle. So pharyngeal tubercle, it gives the insertion of the uppermost fibers of the superior constrictor muscle, plus also the attachment to the pharyngo-basilar fascia is also attached to the pharyngeal tubercle. And a few fibers of the middle constrictor are also inserted over here. In the anterolateral part of the foramen magnum. Here lies a convex articular facet. This concave articular facet is kidney shaped with concavity medially directed towards the foramen magnum, and this articular facet is for the concave kidney shaped articular facet of the on the superior articular facet of the atlas, and it forms the atlanto-occipital joint. Just posterolateral to this articular facet, here lies a whole foramen. This is called the hypoglossal canal. Hypoglossal canal, through which the last cranial nerve, hypoglossal pus, become extracranial. Twitch. Then posterior to the foramen magnum, going posterior and superiorly, is the external occipital crest, which lead to the external occipital protuberance, from where towards the mastoid process goes two lines, highest nuchal line, which is ill-defined, and lower inferior to is the superior nuchal line. So this is all about the what is called the Norma Basalis. So whatever is on the left side, same is on the side. So it is the bilateral symmetrical arrangement of the various parts of the Norma Basalis, the skull bone. Thank you.